You just would never really know by looking at Niall today what he's been through, because he smiles his light up the room. I mean, he doesn't really let anything stop him.
Once Niall was born, we found out he had multiple birth defects or things that he wasn't born with. He was missing his right ear. He had a cleft lip and palate. They verified that he had scoliosis, and he had 2 ribs that are fused together. He also had a tethered cord, which means his spinal cord was fused together to his vertebrae.
After that first few hours, Niall needed to be incubated. He needed to be hooked up, and whenever somebody wanted to hold him, his heart rate would go down.
Gives me goosebumps talking about this. But when Niall was just a week old, they were doing all the tests, and he had to get an MRI done, and they had to give him some morphine to calm him down. And well, he had a side effect with the morphine, and he code blued 3 different times.
It was the worst day of our life. We knew how amazing the Family Children's Hospital team was, but until that moment, getting the hard chest compressions over and over and over, we were in the right place.
Niall passed his newborn test for hearing, and then a few months went by, and we noticed, he wasn't responding to, saying his name or noises or sounds. So then we went back in and got his hearing evaluated, and they determined he was deaf. So Niall was around 2 or so when he got his cochlear implants.
However, with this surgery, you don't get to turn on the cochlears for 4 weeks. So that was the really exciting part, was when they turned them on. It was amazing. I'm so glad that we were able to capture that moment.
Seeing him being able to hear for the first time and hear, my voice, my wife's voice, warms your heart. He's still nonverbal right now at this point, but we're all taking ASL sign language class and learning how to communicate with him.
We're hoping he's going to speak someday. He has great speech therapy at the University of Iowa Wendell Johnson Clinic. Twice a week he goes there with the team and works on both ASL. He uses an AAC device, which is a device to help him communicate. He's making progress.
So Niall has had 11 surgeries total so far. Some of the big ones are obviously his cleft lip and palate, his cochlear implants, his tethered cord. He's got these magic rods in his back for the scoliosis. I tell everyone they're kind of like a hydraulic piston in his back. And after surgery, he actually gained 1.5 inches. And then he goes in every 3 months and gets an x-ray. And then they see how much he's grown, and they take this big magnet on the back of his back that makes those rods internally grow. So it eliminates a lot of surgeries. Niall will be a patient here at the university for a long time.
He's resilient, he's kind, he's happy.
Niall Crone loves to be outside. He loves to ride his 4-wheeler. He also loves to do whatever Dad is usually doing. So Stella is Niall's younger sister, and they're 16 months apart.
Stella, and that's Niall.
They are like 2 little peas in the pod, and I can tell you, Stella makes up for Niall being nonverbal.
We love to play games together, and we love to play hide and seek together, and we love to play
She's a good sidekick for him. He doesn't have trouble sticking up for himself, but she'll stick up for her. There's nowhere else we would rather be. We're so grateful. The team just goes above and beyond. They work past their shift just to make sure that that child is taken care of. They want to take care of that child like it's their own.
So Niall's taught me that I can push myself through a lot more. So when he walks into the room, it just lights up, and everyone is in a better mood when they see Niall.
Yeah, I just can't believe all that he has been through, and we know he has a long road ahead, but that's okay. We'll just do it day at a time.